clarification. Dr. Hussey said this just now, that children are aware of e-cigarettes and they experiment with them. Would you agree with me, Dr. Hussey, that that's what young people do? They experiment with a whole host of products, whether that be alcohol, nicotine, e-cigarettes, perhaps legal highs, illegal drugs. But is there any evidence that young people currently using e-cigarettes are young people who have experimented, that have gone on to use them, sustained use? Or actually, would you agree with the UK Faculty of Public Health that actually says in the evidence they gave to us that actually in the UK regular electronic cigarette use is almost exclusively confined to young people who have previously smoked traditional tobacco products? And actually, in the evidence that we received from Cancer Research UK and Ash Wales and Professor John Britton of the UK CTAS, actually there is virtually no evidence that actually young people using these e-cigarettes were not smokers beforehand.
It's an interesting area to try and tease out what the research is telling us. I think there are clear signs, that, as you rightly say, that young people are using them, they're available, they can get hold of them. I think our estimate was of the surveys and trying to work out how much use there is in Wales, that possibly up to about 25,000 children, young people between 11 and 16 have probably used them, tried them. And of those, about half are probably never smokers. So it's trying to work out, based on what we know about behaviours, mimicking of the hand-to-mouth actions, all the things we know from conventional tobacco, trying to predict what might happen in a few years' time. This researcher says sometimes it can take some years for that behaviour to develop. So it's quite hard to predict how that might go. Where we are now is, as you describe, limited use in regular use amongst young people, but it's one that has to be very carefully monitored. The consensus that's emerged from everybody, as far as I can see, is that more research is required on use amongst children and young people to really understand what's happening in that particular group. I think everybody recognises from the evidence I've seen that that's the group we're most worried about, in terms of really trying to quickly understand the place that these products are taking in their lives.
Thank you. So the issue is there isn't clear evidence. There is a consensus that there needs to be further research, and that research needs to happen because we cannot reach a settled point. Can I move on to the other evidence that was supplied by Cancer Research and Professor John Britton? I'm sure you'd agree with me that those two organisations and individuals are certainly no apologists for the tobacco industry. Professor Linda Bald said, the risk is that we will over-regulate, and I think with the public places restriction, for me, the key thing is the message that it sends. It is not evidence-based measure. It sends a message that these products are as harmful as smoking and should be treated in the same way as tobacco. And they are not tobacco, and they need to be dealt with differently. And the Professor went on to say that if we could move all our smokers onto electronic cigarettes permanently, you would save, certainly across the UK, and I can't give you figures for Wales, but across the UK, maybe 5 million premature deaths. This is a massive public health opportunity, and any mixed message that says we should be very cautious about these products is missing the point and is missing a golden opportunity to improve public health now. When we talk about the precautionary approach and wanting to ensure we don't take any action that leads to harm, should the precautionary approach not be applied to the views of people like the Professor and Cancer Research UK, that in moving forward to the proposals in the legislation, actually you could be damaging, putting at risk what those organisations, one, don't support the tobacco industry in any way, reducing harm from what we all agree is harmful which is traditional tobacco products.
You did answer a similar question with Alan Davis, Minister. Do you want to add
Yeah, sure. I'm happy to answer that point. Kirsty's has read out extracts from 2 witnesses. I disagree with almost every single proposition in what was said to you by the first of the 2 people that you read out. I think they are simply assertions of a point of view rather than anything the committee should take any more seriously. I take more seriously the second witness because I agree with the first half of what he had to say and then simply disagree with him on the second part. I said to you earlier that there are some people who you have heard of who say that the advantages to be gained from e-cigarettes are so significant that nothing should be allowed to stand in their way. And that's the point that witness was making to you. Where I depart from him is this: I agree with the first part of his proposition that there are very important public health gains that can be made from e-cigarettes when they are properly used in a harm reduction way and targeted at those people who are already users of tobacco. And there's nothing in this bill at all that gets in the way of that happening. And where the UK Faculty of Public Health suggests ways in which their effectiveness as a harm reduction measure could be strengthened, I'm happy to say today that I will look at the things that they suggest to see whether there are any things we could learn from those suggestions here in Wales. Where I depart from the second person that Kirsty quoted from is in then suggesting that in order to reap the potential benefits from e-cigarettes, we should do nothing to control their use, that we should allow them to be used anywhere that anybody likes at any time. And I think that the evidence, not definitive evidence, it's never been our claim that you can definitively come to a position on this. It's where you put the balance of risk. And the balance of risk from allowing e-cigarettes to be used where we have stopped conventional cigarettes from being used creates more harm than it does good. It's a very modest proposal. Anywhere you can use a conventional cigarette, you will be able to use an e-cigarette. Anywhere where it can be used for harm reduction purposes, it will be advocated as part of a harm reduction strategy. But where there is credible evidence, not definitive evidence, credible evidence from the organisations that this committee has heard from, who say to us that unless we do things to stop them undermining the ban on conventional cigarettes, from allowing all that ground we've so painfully gained in stopping conventional cigarettes from becoming normal, to lose all that ground, and from opening them up as a gateway product to children, then we must take some modest measures to stand in the way of that harm. Your second witness doesn't want that to happen. I do.
Come back to us, too.
I mean, from a philosophical point of view, for me, any imposition on a person's liberty has to be judged very, very, very carefully. And even a modest imposition on an individual's liberty, I think, has to be justified. You say that there is evidence on both sides, but I would reiterate the point that Alan made. This is not a 50-50 split of the evidence. This is not evidence that is equally balanced on both sides. And we have consistently failed to see in this committee over recent weeks that balanced evidence in relation to the 2 justifications that the government is putting forward. We have not seen overwhelming evidence to suggest that these are a gateway product, and we have not seen any overwhelming evidence, not even definitive, but not even overwhelming evidence, that this is a product that renormalises smoking. There are some people that have suggested, but it's not just not equivocal, it is simply not even overwhelming, Minister. And you surely, before you impose restrictions on people's liberties, there has to be a more compelling and equivocal evidence that people have been able to produce in this committee so far.
Well, I profoundly disagree with that point of view. The idea that you have to have overwhelming evidence is not a test that any sensible person would wish to apply in this area. The evidence is equivocal. The position of the government is supported by your Chief Medical Officer, by the British Medical Association, by the World Health Organisation, by the Welsh Medical Committee, the Welsh Dental Committee, by the Royal College of GPs, by the Royal College of Midwives, by the Royal Pharmaceutical Society, and by a long list of other very serious and credible individuals and organisations that I can relay to this committee. It is absolutely not good enough to say that all their views can be simply set to one side and not account for anything, because they do not amount to overwhelming evidence that harm is not being created. All those people tell you that harm is at risk of happening, and that there are things that you can do, as legislators to prevent that harm. I think you should listen to that very carefully indeed. And the idea that it is for public health physicians to prove to you overwhelmingly that harm will not happen, that that's the proper test to apply, it really isn't at all. The test is the one the BMJ set out on the 15th of September, that where there is uncertainty in science, where some credible and serious people tell you that harm could happen, and others tell you that harm might not happen, it's for those people who say that harm won't happen to convince you, not those people who say that harm could happen and harm that you could prevent. That's what this bill is, in its very modest way, is trying to do.
I think we've explored that particular avenue quite a lot this morning. So if we can move on to the avenue of questions. Darren?
Minister, can I first of all congratulate you for doing what many people thought was not possible. You've brought together the tobacco industry and anti-smoking campaigners and cancer charities, which I think is a formidable achievement. You have described again this morning, as you did in the previous session that we had with you, your proposals as being modest proposals. When the smoking ban was introduced on nicotine products, that was described as a huge step towards reducing harm from smoking, and it was. These proposals are not modest, are they? They're actually a significant step in restricting the ability of those people who are reducing harm to themselves and other people by using e-cigarettes as opposed to smoking. Do you accept that your proposals are not modest and that they are not the small step that the Chief Medical Officer actually set out? They're actually quite significant.
I will reiterate, we've answered these questions quite substantially this morning. Minister, do you want to add anything to that?
Of course, I'm very happy to answer that. The